about 20 million vaccines distributed, only 6.7 million actually given as shots. That's about a third of them. What percentage of that do you think is due to logistical issues that have been well documented? What percentage to some apparently unexpected vaccine hesitancy?
I think it's a combination of both. I think you have clearly a lot of logistical issues. You know, federal government put the vaccine down to the states and then sort of told the states it's up to you to distribute and to administer. And there are two things happening right now, Frank. Number one, you have hospitals are overwhelmed, so nurses are taking care of patients in the hospital. There's not enough nurses in hospitals to then go and vaccinate. And healthcare systems public health departments have been underfunded, and therefore in public health departments, you either have to be, you're either doing COVID testing or you're doing COVID vaccination, but there's not personnel to do both. So you have a lot of logistical issues, but you add to that some degree of hesitancy, and we simply need to do a better job communicating to people about the benefits of the vaccine versus the theoretical risk at this point in time.
So what is your take on the vaccine hesitancy, including among frontline healthcare workers? We spoke to a number of health systems all across the country, and we've heard from different ones. Now, of course, this is not a national stat, but we've heard from different ones that about half of their healthcare workers are willing to take that shot now, and the other half are either saying no or they want to wait.
Well, I think that what you have to do is really understand the reasons why they want to wait. I spent last Saturday in my healthcare system administering shots, and I actually went up to the nurses' stations and talked to nurses, and some of them were not necessarily hesitant. They just had some doubts. They wanted questions answered, and when I spent time answering their questions and clarifying the issues, they were willing to take the vaccine. So I think, a lot of people have questions, and I think it's okay to have questions, but we need to be able to answer them. And of course, it takes a lot of time. It's really a one-on-one effort. Just telling people it's okay, you need to take it is not enough. You really have to listen to people. You have to hear what they have to say. You have to hear their concerns, and then after you do that, they'll be more likely to take the shot. But obviously, that's going to take some time. It's not immediate that people will say yes.
Yeah, Dr. Del Rio, I think people do have a lot of questions. I think one of the big questions that people have is what stats should we all be paying attention to? Early on in the pandemic, we paid attention to the mortality rate. We were told that was really the key to seeing how bad this epidemic was. And now we've paid much more attention to the case rate, or the number of cases per day, while the mortality rate has declined. So which one do you pay attention to, and which one do you use to assess just how bad things are?
I think it's a combination of things. Three things that I pay attention to is the number of new diagnoses, but obviously that's influenced by how much testing is done. I look at deaths, but I also look at hospitalizations. At this point in the pandemic, we have over 130,000 Americans who are currently in the hospital with COVID. That's an incredible number. In some states, one out of every 3 beds is occupied by somebody with COVID. And that to me is really a concern because, you start looking not only of the overwhelming and of hospitals for COVID, but it's actually for everything. If you have a stroke, if you have a heart attack, there may not be available for you, and that's a problem, right?
Shepard Smith here. Thanks for watching CNBC on YouTube.